Hi, everyone. I'm Dr. Jory Fleischer,
And I'm Sarah Mitchell Chen.
and we wanted to welcome you to Rush Recaps. So this is a series of short educational videos that we have created for you, our patients, our families, our care partners, based on the questions and concerns we hear really frequently from you. This project is supported through a generous grant from the Parkinson's Foundation to improve the quality of team-based palliative care in Parkinson's disease. So with that, we would like to start with one of the questions that we hear most commonly, which is, Sarah, how do you figure out how much care you need for your loved one?
That's a great question. And it really does vary from family to family and person to person. But there's three main questions you might want to think about that can help frame your conversation. So you want to think about what are some things you need help with? When do you need that help? And by thinking about that, it will help you determine then how many hours do you need help. So when you think about what are the tasks you need help with, you might want to consider, are there certain things like cooking or housekeeping, laundry, getting ready, going for the day, getting ready for bed at night. Those are great things that can begin to help frame the conversation about how much help you might need. Also, ask your family, ask your care partner. They may be starting to take over some of these tasks and can also help figure out, oh, it would be really helpful if we had someone coming in that could change the sheets and do the laundry once a week, so that we knew those tasks got taken care of. You may also want to think about, are there certain times of day that you need help? Maybe mornings are a little bit more difficult for you. It's slower for your medication to kick in. And so you're needing a little help getting up, getting dressed, getting cleaned up for the day, getting breakfast. That might be a really great time to bring in care. And then while that caregiver is there, you can think about, what are some of the other tasks you can include in that chunk of time, like meal preparation or cleaning the house or doing some laundry or things like that. And then think about, do you need that help every day? Do you need that help Monday through Friday because your family is able to come on the weekends? Do you need that help a few times a week because maybe you don't need it every day, but there are certain things you are needing help with? And create a schedule that can be really helpful for families to think about, utilizing the time that the caregiver is there so that you're making sure tasks are getting addressed, but you don't have the burden of always having to remember, like, what am I going to have the caregiver help with today? That can sometimes be a barrier that we hear, is that, what is this caregiver going to do? Are they just going to sit on the couch and stare at me all day? And can be really uncomfortable to have to think on the spot of what the caregiver is going to do.
So you're saying, like, write out an actual list of, like, when you're here on Tuesdays, start, get my loved one dressed, and then while they might take a morning nap, if they're taking a nap, that's when we do laundry, or that's when you could help with meal prep, or that's when we could do these things. Like, actually write it down.
Yeah, make a calendar, make a schedule. And then if there's additional, like, one-off things, like the groceries got delivered on the time when the caregiver is there, well, of course the caregiver can help put away those groceries, but that may not be part of the, like, what you've written down on the schedule. So like, between 9 and 12, this is what the caregiver is going to do, and then those incidental things that come up along the way.
And is it better to do that at the outset, Sarah, and sort of set those clear expectations, or do you think people should kind of figure this out as time goes on, as they get to know each other?
It can be helpful to try to come up with a plan on the outset, and then continue to reevaluate as time goes on. So maybe set, like, we're going to try this arrangement for a month. We're going to see how it's going. And then we're going to come back together as a family and care partner and patient and say, what's working, what's not working, how could we, like, modify the schedule, and then, let it make modifications, let it run for another month or two, and sit and reevaluate. It is really helpful to have clear expectations at the beginning. That can be beneficial for everyone, and you may get the most out of having that caregiver with some expectation, clear, like, ideas of what people are going to help with, recognizing that things may change over time, or you may discover, actually, it's more helpful if they do XYZ rather than EFG. And so you're going to coordinate as time goes on.
Love it. We have lots more content and questions that we hear all the time about caregiving. So stay tuned and check out some of the additional Rush Recap videos about that. So thank you so much. And if you want more, please explore the growing library of these and other videos created by our team on the Rush Movement Disorders Patient Education page. Thanks so much.
Take care.